Hello. Thank you very much for giving the opportunity to present paper on attitudes towards autism in Bangladesh and the government intervention. That means the intervention taken by the government of Bangladesh. So before I go through the paper or go through my presentation, I should say something about the society of Bangladesh. As you know, in Bangladesh is a developing countries now, is a fast-growing countries, economically is improving, and now we have our target to be middle income group in 2001. So, but our culture has a lot of stigma, a lot of stereotypes, a lot of discrimination, so, and a lot of poverty also. And as you know that most of the people in Bangladesh, more than 80% or 85% people in Bangladesh are living in the rural area. So they don't know about what is autism, what is disability, the causes, major causes of these disabilities and deformities. But they have their different understanding also. They think that this is autism or disabilities, it is due to the punishment of the Almighty, or maybe is something which is very much stigmatized and stereotype thinking and all about. So I think before we have discussed any intervention program and last 2 days what is discussed in this seminar hall, is more about the intervention program, and there are some program which is related to technical issues, related to improvement of the autistic children. So I think as a social scientist, as social psychologist, we have a lot of things to do work on attitudes, because unless we can change the attitude, so it will be very difficult to implement any development program for autistic children, or for any program of the supportive program for the parents with disability. So with that sense, I just took this opportunity to present here on attitudes towards autism in Bangladesh. So let us think about what is the causes of autism. As we have seen last 2 days, that autism research reports suggest that autism is triggered by virus or genetic disposition. And number 2, autism may be caused by prenatal and neonatal stress or trauma. Yesterday, one present speaker here, he has rightly said that the major causes of autism is the unsafe delivery in the rural area attended by unskilled birth attendant in the rural area of Bangladesh. And there is another growing concern that toxins and pollutions in the environment also can cause and lead to autism. So these are the causes what we, the practitioner, and we, the academicians, are concerned about. But what do you think about the rural people in Bangladesh and rural people even in India and Nepal and Pakistan? Are they believe or are they think like this? They don't have any idea about the causes of the disabilities and causes of the autism. So they think it is because of the fate, or it is because due to the punishment from the Almighty. So there are a lot of prejudice and discrimination in the rural areas, and belief about the autism and people with disabilities. So while I decided to present on this, I had gone through some of the articles and published and unpublished in Bangladesh, but there is a few studies conducted on attitudes towards autism and disabilities. And one of the studies in my department, there's a group of new fellow research scholars, those who have conducted this study, mother's perception regarding significant people's attitudes towards autistic children. So it is also, again, I'm telling you, the perception and attitudes is a very important phenomena to understand in social psychology, because unless we can have any intervention in our cognitive level, in our attitude level, so it will be very difficult to implement any development program or a sustainable program in the society. So here you see the significant people's attitudes are very important. Who are the significant people? It is the people, those who are associated with an autistic baby and with the families of autistic mother and also their parents. So in this study, the parents, grandparents, siblings, classmates, playmates, neighbors, and peer groups have been considered as most significant people for children with autism because they have great contribution to the development of their personality and to develop their development, personal growth, and their survival. So significant people's attitudes towards the autistic children and significant people attitudes towards the mother or family members of the autistic children is very important because it means it is related with their mental health and it is related to their well-being. So it is a very important, and I have found that these significant peoples have a lot of contribution for them. But let's see how a baby with autistic, mother with autistic children, how they feel about these attitudes towards them from the significant people. Mother's perceptions regarding significant people's attitudes towards their autistic children means how they feel about them, how they feel about the autistic child, how they feel about the parents with autistic child. So these are the things are studied in this very small study. And in this study, mother's perception of significant peoples are considered, namely siblings, grandparents, uncles, aunties, cousins, peer groups, and neighbors' attitudes towards their autistic children. In this study, only 8 samples were used. A sample which consists 8 mothers, those who have at least one autistic child, are selected purposively. That means purposive sampling technique were used in this study. And the mother's age range was 26 to 52 years. And the questionnaire used is a semi-structured questionnaire, and clinical interview were taken of all the mothers, and also some case studies were taken to understand and to comprehend the findings in a better way. Overall result shows that attitudes of significant people towards autistic children are undesirable. You see, when the attitudes towards a family or towards autistic child is unfavorable, uncomfortable, so how will you explain and how we will take any intervention program for them to reduce their suffering, to reduce their, and to improve their conditions of the autistic child. So it is a really challenge in the society like Bangladesh. As I told you that the age range of this it will be corrected, and I think this study was conducted actually in the northern part of Bangladesh, which is very much close to the Darjeeling. It's called Panchgad district, in the very rural area. So where the 80% people representing in Bangladesh in the rural area, so only homes for the autistic child and service center for the autistic child in the hospital, in the city area or metro area will not cover whole the country. So we have to think about the community-based rehabilitation because it's more than 85% people living in the village area. So what we can do for them, those who don't have ability to get super specialty service or home service for the autistic children in Bangladesh or in India. So it is my concern to see if we can do in the attitude level, so then we can implement or we can intervene in a better way in the society like Bangladesh. So the result of this study, as I shown in table 1, mothers' responses regarding paternal and maternal cousins, siblings, and peer groups. You see, the parental cousins and paternal cousins and maternal cousins. So maternal cousins, again, uncle's children and auntie's children, and maternal child is uncle's children and auntie's children, and also their siblings and peer groups. You see, there are a lot of semi-structured questionnaire was used, but the most significant results we got in terms of the percentage, in terms of the frequencies, I have been plotted over here, and that don't want to play. That means here you see the 100% of the uncle's children and auntie's children for both paternal and maternal cousins, they don't want to play with the autistic baby. So it is a very significant results what I want to get your attention. And again, even the siblings, also 60% of the siblings, they don't want to play their autistic brother or sister. Even peer group also shows that 100% of them, nobody wants to play with an autistic child in this region or in this small sample. Don't want to participate in family functions. Again, it is very important. Even if it is not practiced in the family, how do you practice in the society? So everything should start from the home. And the same result has been found that paternal cousins, maternal cousins, siblings, and peer groups for this question, they don't want to play, they don't want to participate in family functions. Again, question number 3, don't want to eat in the same table. So again, you see the cousins for both paternal and maternal uncles, and also siblings and peer groups has shown 100% they don't want to eat with their autistic children at home. So it is, now see the scenario. Scenario will give you a very good picture about the rural areas of Bangladesh, the attitudes of the Bangladesh, and this is quite very severe in case of the improvement or intervention program is concerned in the Bangladesh for autistic children or even not only autistic children, but also it is same thing happens for any type of disabilities, people having disabilities. So in table 2, the result shows that mothers' responses regarding paternal and maternal grandparents, paternal and maternal uncles and aunts are reported here. And these results also shows the similar findings that most of them, they feel annoyed with the children's behavior. Autistic children behavior means children with autism. And so they feel disturbed about their behavior. And then neglects the child. They also, most of the cases, they neglect child and they avoid them in their interaction, in their social interaction, in their family interaction, in whatever it is. So they have less type of communication and always try to neglect and avoid them. And they don't want to go with children in the functions together. So you see, again, it is a discrimination and the attitudes towards the autistic children is very vulnerable because it is practiced in the family with the significant people. From those we supposed to expect help, support, we expect support from them. Instead of support, we are getting hating behavior, annoyed behavior, and avoidance. So it is very frustrating. It is very frustrating and very frustrating and unfortunate for the people with an autistic child. So these are the major findings we had in this study. And results, the summary of the results, you see, the children's paternal grandparents show more negative attitudes than the maternal grandparent did. Again, this is very significant. You see, those are the blood connection. Those with the autistic baby who is very close connection with the blood. That means the paternal grandparents, and also paternal uncle and uncle's wife, and the auntie's wife, they have more negative attitudes towards the autistic babies than the paternal uncles and paternal grandparents. So it was also found that peer group and neighbors show more negative attitudes toward autistic children. It is always so in everywhere, in the class, in the playground, in the school, in the social setting, in social functions. And they have experienced that there is always have a very negative attitudes towards the autistic babies and those who are having autistic child. So unless we have some work on the changing attitudes of the people of Bangladesh and people in the society, and even those who are working for the autistic children, I mean the practitioner, I mean the researcher, I mean the caregivers, if we don't have positive attitudes, that positive attitudes always have is a motivating factor for us to give a better service for the intervention for the autistic children and to support for the families with autistic baby. So these are the major findings we had in this study. Results gathered through clinical interview indicated that comparatively grandmothers, wives of father's brother, wives of mother's brother, husband of mother's sister tried to avoid their autistic children having felt disturbed. So it's a very severe case, not to see the positive way, rather they also feel disturbed about their autistic child. Mothers of autistic children are mostly unwilling to go to their children, go with their children to any relative's house for an unknown fare. So in the case studies we have found that there is always fear from the society. There is always fear from the relatives. There is always fear from the surroundings that they have their inferiority feelings, having a child with autistic and or any type of disabilities. So they always try to avoid social functions, to attend the relative's house, even to don't go to the services, even care service station. I mean, they don't like to go to the hospital also. Even I have a good story that once I had a project to counsel the IPTIS girl, and I had some of the research investigator, female investigator, to find out those who are victims of teasing and those who have very bad mental health condition to diagnose. After the diagnosis, we had a series of counseling session. We are in a series of counseling session, but they were unwilling to come to the counseling center. And they asked me, if you just put out this signboard, then only will you be able to come. Otherwise, if you have put this signboard as a counseling center. So we have our fear from our society that if anyone knows about our problems, so it will be bad for us to lead our normal life in the society. So it is the real picture of Bangladesh as a social psychologist and as a practitioner and as a very layman in the society. We can realize how severe it is. So we don't want this. We want to overcome this situation from our society because this is inhuman. This is actually, so that there are a lot of intervention program nowadays government has taken and which is working very well. And now the attitudes towards the autistic children are changing in a so fast that you cannot imagine. So most of the mothers stated that they were held responsible for giving birth of such a child. So even they feel guilt that I have this child, it is because of my sin, it is because of my fate. So it is something which is very odd to think about their child by mother. So finally, mothers mentioned that neighbors and peers of autistic children carefully avoided them in different way, in different type, in different angles. They always try to avoid their families also. They don't want to keep a good relationship with those families. Even teachers, many school teachers earlier, I have seen, they were unwilling to register them in the mainstream school. Though for them, we need a lot of specialized school, vocational school or something like this. But earlier, we don't have any available vocational school in all over the Bangladesh. So people, those who are willing to send their children, it's supposed to, but the government law was there to, you don't ignore, you will not able to ignore any child to get it admission in any school. But it was happened several times and we face it. We have seen it in our practical. So mothers would not like to take another baby after having one autistic child. There is another very structural thinking in our society that once you have any babies with disabilities, even not autistic, any type of disabilities, so they don't want to take further baby, so that they think it will be more difficult because it is already difficult and was overburdened for them to mix up with the normal life and normal health, with a good mental health and so on. So they are always unwilling to take a further child. What are the family consequences in Bangladesh? In Bangladesh, mentally sick people and its family members is victim of social discrimination, distress, humiliation, and injustice, which causes mental illness among the parents and having autistic children. You see, if there is discrimination, if there is a deprivation, if there is a distress and humiliation all the time, in different angles, from different, not only those who are illiterate, but even the educated peoples also, they have their negative attitudes towards the autism and towards the disabilities. So it is very difficult for them to survive in the society, to being a healthy life, to lead a healthy life. Thus, parents of low-income countries experience a social stigma for having a child with autism spectrum disorder or mental disabilities. They encounter social discrimination and experience increased levels of parental stress. And this leads a lot of stress among the parents with disabilities. So you see how mental health is important, how mental health is important for us to live in a healthy life and with our physical health. Is equally important. It's equally important for us to see the mental health aspect of the all human beings, as well as those who are having autistic or mentally or physically disabled child. Researchers reported that the paternal increases stresses causes limited father-child interaction. Of course, once you are having such type of discrimination in the society, you will find a lot of difficulties, and the fathers who are children having autism. And so reduce children responsibilities and helplessness, and the prolonged stress among the parents also leads them to substance uses. And many of the parents, they cannot incorporate with the mental health, so that they may become prone to the substance uses. Thus, to reduce this problem, a strong political commitment has shown that holistic approaches should taken by the government of Bangladesh, and the Bangladesh government is now doing a tremendous work on that. And now you see what is the interventions are taken by the government of Bangladesh. At present, the government of Bangladesh has shown a strong political commitment in reducing the negative attitudes and stigma related to autism and mismanagement. And the Ministry of Primary Education and Mass Education has developed short episode of Meena cartoon, as all of you Indians know about the Meena cartoon. So through this cartoon, we are developing and we're raising the awareness of autism and also any type of disabilities, and stage performance also taking place in many different areas, between district level and sub-district level. It has been started in 2010. The Center of Neurodevelopment and Autism Center has been inaugurated, and it is established in Bangladesh. And Shishu Vikas Kendra, again, for the first time in 2010, Bangladesh government had introduced and established child development centers in 10 medical colleges. And child with any type of disabilities or deformities or any type of autism or slow learners, for them, anyone can come there, and they have their specialized services for the children. And then, from then all other private medical colleges also increase their services. Now I have 3 minutes more. So, moreover, the government initiated 73 disability service center in district level and Upazila and sub-district level, as a special autism corner also available in all medical colleges and specialty, and also big hospitals. Autism was incorporated in the primary education curriculum. We have incorporated awareness program through incorporating these things in the primary level education included in the curriculum, and not only in the primary level, but also in every grade we have incorporated in the curriculum up to the 10 grades. So it is now working very well, and people's attitudes are become turning positive to the society. The government has developed a strategic action plan for children with special needs under umbrella of inclusive education. So it is very important not only that we think about this specialized education and all this, but we have to intervene in our attitude level also. Because unless we are ready to accept the positive intervention from the society, so it will be very difficult to implement or to take any type of intervention plan. So people will not accept. So unless you have positive, and in earlier session we had said we have to take it from our heart, bottom of my heart, so that our action will be different. If I don't believe it, if I have negative attitudes, so I should not work for those people, because first of all, I have to change the attitude of myself. You know, not only it is because of education and uneducated people in the rural area, but even educated people also think differently. Even once I was studying some of the books on autism, my wife said, "Why are we studying these things? Don't study these things. We need another baby in future. So you don't go through this." And later on, I started teaching her. I started trying to motivate her to change the attitudes. And you know, after some days, she was telling me, you go to the autism conference and bring something which is good for us. And you can now work on autism. Thank you very much.